Hello. Hello, everyone. I would like
Hello,
to.
the viewer.
Hello. My name is Dr. Sarmila Sinha. I'm a consultant psychiatrist in the UK. And it is my pleasure today to welcome Dr. Arghya Sarkhel, consultant psychiatrist from the UK, from London. So we're just going to give about a minute for people to join. So it starts at 1 o'clock, our live Facebook stream. So we're just going to wait for a minute and then we're going to start.
Sure.
Thank you to all of you who have joined us live. Welcome, Dr. Sarkhel.
Thank you. Thank you, Dr. Sinha. Thank you for inviting me. And it's a great initiative that you have taken, and it's a living life stress-free or organization, and it's a fantastic initiative. And we could not have done this in any other better time than what we are going through at present.
Absolutely, I agree. I agree. So today, we did not have any problem. We already have few viewers who have already joined in.
Oh,
I
excellent.
want to remind everybody that this will be a recorded version. We will be recording this live stream and then we will rerun this as a podcast later on as well as on YouTube.
Sure.
So please stay tuned. We are going to have a very interesting discussion today. So let us begin, Dr. Sarkhel.
Yes.
I would like to introduce Dr. Arghya Sarkhel. Dr. Sarkhel has completed his higher specialist training in adult psychiatry, old age psychiatry, and liaison psychiatry. He is a member of the Royal College of Psychiatrists, and he was awarded fellowship not too long ago. Dr. Sarkhel completed his master's in neuroscience with distinction from King's College London, and he served many years within the NHS as a psychiatrist and went on to become a consultant psychiatrist. Currently, he's practicing in an independent sector. He's leading the organization Living Mind, which is dedicated to promoting an integrated approach in the field of mental health. I'm pleased to say that he's one of the few psychiatrists in the country who delivers RTMS, or repetitive transcranial magnetic stimulation. It's state-of-the-art, non-invasive, drug-free treatment for depression, anxiety, and other disorders. As you know, that I have been interviewing a lot of inspiring individuals during the COVID period, and it is my pleasure to welcome Dr. Sarkhel during these times, as we really need more discussions on how to manage mental health issues during this pandemic. As you know, we have been stuck in this situation since the beginning of this year. So many people, their jobs are at risk. Children are not able to go to school. And even now, even with the Prime Minister, Mr. Johnson, giving us some update yesterday, but I think there is still a lot of uncertainty within people's mind, and we don't know which way we are going. We don't know when is this going to end. And therefore, I think we really need to discuss about the mental health issues. So welcome, Dr. Sarkhel.
Thank you. Thank you, Dr. Sinha. As I just mentioned that, first of all, thank you so much, particularly yourself and you taking the lead from Living Life Stress-Free organization, which I'll always want people to have a look at your website. You're doing a fantastic job, and particularly in this unprecedented time where stress becomes an immense issue 24/7. So, and thank you very much for your kind introduction. That's very nice of you.
That's my pleasure. So, Dr. Sarkhel, I want to start by asking you this question. Uh, what do you think will be the, or is the impact of this COVID pandemic on our mental health? It's impacting, all over the world. It's a global phenomenon at the moment. Everybody's affected, elderly, young age, children, adults, parents. So if, as much as you can, if you can broadly, because you cover both old age as well as general adult. So if you can tell us about, what is the impact of COVID on this pandemic? Thank you.
Yes, and I want to just pick up the thread that you were just mentioning in your introduction, the word uncertainty. And I think if there is one sort of theme about today's conversation, and perhaps the source of perceived stress around our mental health, our physical health, rightly or wrongly, is an uncertainty. It's a constant source around us. Anywhere, as you said, is a global phenomenon at present. So it's important to understand that none of us, including you and I, are immune to any mental health difficulties arising out of this current environment. So it can affect any one of us at any time. Of course, some of us had some experience of suffering through some emotional difficulties. Some of us, maybe the first time in their life, suddenly looked at, well, you know, not sure how I'm feeling mentally, maybe a bit of instability. So, and, uh, and it all depends on our previous experience about our mental health or mental ill health, depending on the environment we were in or we are in, perhaps, or even anticipating. For example, as the lockdown is going to be slightly eased, what sort of environment we are going to encounter. And that will lead to another set of uncertain situations, and we will anticipate the things that perhaps we really don't have any answer. So, you know, to summarize, really, it can affect any one of us, and we can come to the individual mental illnesses separately, but in terms of we can go through lots and lots of different emotions. Sorry, I cannot hear you.
Sorry.
No, that's fine.
Yeah, so there is a lot of emphasis on anxiety and OCD, and I think the World Health Organization recently, they have updated their website as well,
Mhm.
warning people about the impact of this, particularly on OCD.
Yep.
What are your thoughts on this, or obsessive compulsive disorder?
Excuse me. So, as we know that for viewers who are not familiar, many of us at least have heard the term OCD, which stands for obsessive compulsive disorder. And as the name states, it has got two components. One is an obsession, which really what we mean is a repetitive, intrusive thoughts. We know they are irrational. We want to get rid of it, but we are unable to get rid of it. And often we hear about the contamination with the germs being one of the common obsessive thoughts we have. And this obsession then drives us to engage into some kind of ritualistic behavior, could be washing hands repeatedly, could be touching things symmetrically or certain number of times. So that's what makes what we call OCD, provided the symptoms are affecting in our social functioning as well as functioning at work, perhaps, if that's relevant. So now if we can imagine about this, well, we don't have to imagine really, we are in this coronavirus pandemic.
Mm.
So we might think, well, rightly, we need to take precautions, and that is fine. So it is very important to understand where is the boundary, where we call is a rational response or understandable preoccupation with the virus related health anxiety, perhaps contamination with the germs, because we already have so many government guidelines from different parts of the world, WHO, as you said.
Mm.
But actually, people who have got OCD or who might have developed OCD during this period will see a much, much more intense and frequent preoccupation, which is really beyond what you and I would think is an understandable reaction. So, what I mean by that, say, for example, that yes, we need to wash hands saying happy birthday twice or 20 seconds, whatever. But imagine that then tends to thinking about 15 minutes every time I'm washing my hands, and that goes on to 50, 60 times in a day.
Mm.
So you can see where the normal response can become slightly pathological, and that takes over our life, slows us down, uh, brings us a halt to our performance at home, at work. So I hope that I've given some indication that current situation about anxiety related to coronavirus, especially the health anxiety, can precipitate a relapse of OCD, someone who had been stable for a while, or someone who might have a vulnerability to develop, and all we needed this kind of stress. Am I
Yes,
clear?
yes. Thank you. Thanks a lot. And how do we manage our anxiety levels during this period?
Yes, and this is where it becomes very important. We have several approaches. My first approach would be it can start with your friends and families, just sharing your thoughts if that is appropriate before we even begin to think about getting professional help. So, what I mean by that, if I am very anxious
Mm.
and it's really slowing me down, it's affecting my performance, it's very important if I can confide in to someone who I trust,
Yeah.
could be my friend,
Mm.
family, and it's inevitable that that will relieve at least some of the stress on our shoulders. So we'll start with that. Then, of course, if it is someone is already having some therapy, pre-existing history, then they could just pick up the phone to see they can have some top-up sessions with their talking therapist, whether it's a counselor or psychologist or even psychotherapist. And there are various approaches one can deal with that. For example, in cognitive behavior therapy, we are taught to identify our catastrophic thinking and how to challenge those thinking by keeping a thought diary, and some techniques where we call flashcard techniques, where we write down some of the facts that will challenge our catastrophic thoughts, and flashing those thoughts again from a written card that will help addressing some of the stress or anxiety related to this obsession. Of course, psychotherapy would be another route. However, it is very important that there has been a huge research in OCD, and we know quite a few areas in the brain, and particularly one in the front part of the brain we call orbitofrontal cortex, and that is affected significantly in OCD. And we do know that medications play a significant role. So, and they are quite safe to take it. So, first port of call after talking therapy, please do not hesitate to talk to your GP, at least in UK. If you've already got your psychiatrist in NHS or private psychiatrist, see if you can talk to the team and get at least one off assessment by the psychiatrist, whether you need to just tweak the medications and perhaps a new medication is important. So it is a combination of treatment for both talking therapy as well as the medication.
Thank you, Dr. Sarkar. That was really, really quite helpful and very insightful. I think people need to first recognize the symptoms themselves, isn't it? And if somebody is the sleep having going through symptoms like sleep disturbances,
Yep.
suddenly they are feeling panicky for no reason, and if they find themselves worrying all the time, I think those are one of the classic definitions, like if to find out if something is not something's not right, isn't it? So symptoms, these are the just basic things which they can identify that something is wrong, and then first port of contact is their loved ones, talk to friends and families, and then seek help. And I know people are quite um, anxious about actually going out of the house to seek help.
Yes.
So I think lots of GPs or family physicians are offering remote consultations, like online consultation. And I think people need to take advantage of that. And if it becomes unbearable, if it becomes really very significant, then obviously there are emergency services, isn't it? Like people can call 111 and seek help. And I think it's important to take mental health issues seriously, as well as if anyone is a carer listening, and they should not dismiss these symptoms, because I know at the end of the day, COVID is important and significant. It's a respiratory illness. But I think if someone is experiencing mental health conditions or mental health symptoms, I would request people not to dismiss them or ignore them, because they could be COVID.
Absolutely.
Yeah.
And I completely agree. Just like if we have got a sudden cough, not stopping, sudden temperature, these are the alarming symptoms of COVID. Equally is important if there are some kind of different sort of mental state that we're experiencing, to take it very, very seriously, because help is available and most of the conditions are treatable just like other physical illnesses. So it is very important for the viewers to know that help is available. Yes, it might be in a different format now through online video consultation, and there are effective treatments.
Just wanted to remind everyone, all of
Sure.
you who are listening, we have got quite a few viewers who have joined us live on Facebook. If anyone has any questions for Dr. Sarkhel, please write them on the comment section, because I'm actually seeing all the comments, and I can take one or two questions for Dr. Sarkhel. So please don't hesitate. Please write down any comments that you have. So let's continue, Dr. Sarkhel. I'm actually quite also interested in this, the fear. Fear is one of the core symptoms, isn't it? It's one of the underlying symptoms of anxiety, depression. So there is this thing, fear of uncertainty, fear of loss of loved ones, and things like that. And I would like you to put some light on this issue. What do you think people should do when they're facing this intense fear of, this death, this fear of death or fear of losing a loved one? How do we navigate through
Yes.
difficulties?
It's a very important topic you touched, Dr. Sinha, and I'm glad that we are able to talk about that in this forum. Now, fear is, in general, is a very natural response when our mind perceives that we are threatened, whether it's a threat from health, threatened from some other sources. So clearly seeing all those figures in everyday updates, so many people are dying. We have got our, elderly relatives or family members. So it's a very rational response to a degree. Uh, but again, as I talked about in OCD, that is important to recognize that when it is that response of fear going over and above that one would normally expect from the current circumstances. And what is the best gauge? Look at our functioning. If we are slowed down, if we start avoiding things unnecessarily, if we are performing not so well at work, those are the telltale signs that, look, I might need help here. So I think that's the first thing is important. And we talked about talking therapy, we talked about the medication, but one of the things is very important, particularly in this fear, I want to introduce now or talk about mindfulness, because that's an incredibly powerful tool. I still think it's still very much underused, and it's a concept that initially came from Zen of Buddhism, and the whole idea of that is it gives us a skill to embrace good emotions and bad emotions. The reason we are fearful because we feel threatened, and it's an emotional response. Whereas doing some regular mindfulness exercise, that will teach us the skill how we can accept the feelings as it is, rather than having to react on it in a very pathological manner. So it's important that there are plenty of books, there are plenty of exercise, and if you could go to Spotify or YouTube, and if you could just type my name, you will see there's an album called Mindful Living, and I have created 10 separate tracks for different conditions. And in fact, one of the conditions is managing anxiety. And the essence of that is really is simple breathing exercise. It is not religious, it is not a spiritual, it's an entirely a psychological process, psychological exercise, and that improves that frontal lobe functioning. And this is well researched now, through various functional neuroimaging studies. So I'll strongly urge that, first of all, to recognize and what we do about it, try the mindfulness exercise first. It'll put us in a much more relaxed state so that we're able to deal with the fear a lot better. So that's an idea, rather than expecting the fear will go away completely. So it's a different stance.
Yeah. Thank you. That's, I think, the issue of the concept of mindfulness has been there for quite a long time. And I think now is the time to actually bring it to practice, because these are really simple tools. People can implement these at home. And I
Absolutely.
think one of the things you also do, and which I also do, we both of us kind of see eye to eye in this, that we are advocates of guided meditation. I think that's the
Absolutely.
good way to relax.
Yes.
And I know I have seen your CD. It's a wonderful CD.
Thank you.
What is the title of the CD again? Just remind me.
The title is Mindful Living.
Mindful Living.
But
Yes.
it's important that probably if someone wants to search for it, it's better to search by the artist rather than the living, because there might be several same named albums.
Yes. So,
And it's available everywhere:
it's
Spotify,
available.
YouTube, any digital platforms, Google
Yes.
Play.
Yes. So that's a very good resource. People can stay at home, listen to it, and then I have also got some podcasts on guided meditation. People can listen to them.
Excellent.
I think it's good that more and more psychiatrists are approaching the holistic approach, isn't it? And you know, we have to combine this the concept of mindfulness in psychiatry, and I think it's really important that more and more
Absolutely.
psychiatrists are advocating this. It's really good.
Yes, and I think at the same time, I am aware that you do run one-to-one as well as group courses for the stress
Yes.
management, and I have got excellent feedback from people who have attended your workshops. So
Thank
I'll also urge the viewers strongly to contact
you. Yeah.
you, and it's good that you can actually run that without having to have face to face, physically. You can run that virtually, so which is great.
Yeah, yeah. And yes, I will make a short announcement at the end, because there is a free webinar coming up, and I will
Excellent.
make that announcement in the end. But let's move on. I think I'm really fascinated with this, non-medical approach for addressing mental health issues, because so many people they prefer not to take tablets and medication, and sometimes we feel a bit lost. We feel helpless or how to help them, and this is what led probably you to consider RTMS, because you're one of the
Yes.
very few psychiatrists practicing this in your field. So could you
Uh,
talk us through what is
yes.
RTMS, what its
So
implications are?
sure. So the way I think RTMS, and I think it's very so when you talked about the medication, that's what you call like a chemical modulation. So you are modulating the chemical imbalance in the brain. When we talk about talking therapy, we are modifying or trying to modify our behavior or thoughts. There's a thought modulation or behavioral modulation. And in fact, now there's a much more emphasis on the brain circuits. And we do know that brain circuits, they do have a big role to play. And that's the function sometimes get overactive or less active. And that gives rise to the symptoms of depression, anxiety, OCD, etc., etc. So that was the basis, and that's what we mean by electrical modulation, because in brain the nerves are connected through electric energy, and if there's a deficient, particularly in the depression, in the front part of the brain, what we call frontal lobe, there's a circuit that they're slightly loosely connected in patients with depression. And that is well proven in many, many studies, the imaging studies. So, what the transcranial magnetic stimulation does essentially is it's a magnetic coil that sits on the head, slightly like a 45-degree angle, and it emits some magnetic pulses. So, it is important because we're not giving directly electricity. And that is the big difference from ECT, where we see and lots of side effects. For example, memory problems in one of the commonest ones people report. So this one does not have any of that. The reason it isn't because it's a very focused treatment. We do not need to give the whole brain a high voltage electricity. So we're giving magnetic pulses and very cleverly using a very fundamental physics law, what we call Faraday's law, that magnetic energy then within the brain converts into electric energy. That's a fundamental of RTMS. So when we do that repeatedly, for example, 5 treatments a week for 6 such weeks, so 30 treatments altogether, it really helps to reinforce and to strengthen that circuit which was loose. So we can actually fixing the problem where it was needed most. So it is very focused, and the tolerability is fantastic because there is no risk of memory loss. For example, in ECT, does not need anesthesia. So patients can just sit or lie in a couch, can talk to us during the treatment, can read a book, can watch a video, and occasionally people can get a headache, but that's again very temporary. They can just have paracetamol if it is too intense headache, but certainly there is no memory loss. Now, it is important that the most of the research is done so far in the whole world is on for depression. And at the moment, it's also recommended in UK that the NICE guidelines for treatment-resistant depression. However, I want to make it a point that if people have a choice, and of course, it's mostly available in private sector now, and if they can afford, then they have got the option. They do not have to necessarily wait till it becomes a drug-resistant depression. So people who do not want to take antidepressants or the drug route, then this is a very, very equally effective, if not more, treatment choice for depressive disorders. And that is mostly, most widely studied. But we do know that there are other indications, like anxiety and OCD are the two very, very common disorders that is successfully treated by RTMS. An interesting thing to note is that even people who are on medication, perhaps they have not responded as much they wanted or the psychiatrist expected, it can actually optimize the outcome of the existing treatment. So we don't have to stop the treatment if someone is on medications or on talking therapy. We do also know the current evidence suggests if someone is having talking therapy, having RTMS improves the outcome of the talking therapy. Because clearly you can imagine, we can have more concentration, we can engage in the therapy more, our information processing skill gets better. So it makes sense to combine that approach. And that's what I mean by integrated approach. So hope I have given a very short sort of overview of RTMS. And but maybe it's important to talk about where we cannot give RTMS or where it is not so safe.
Yeah, I think that's important to know as well. So yeah, please carry on.
So the first important thing is if there is any metal piece within our head and face, and sometimes we have a surgery, reconstructive surgery in the jaw and etc., then it is not safe because there's a strong magnetic field. The metal piece might get dislodged. If there's any grommet, especially the old style grommet, that's also can be dislodged. However, it is important to know if someone has got a pacemaker, it's quite safe. People with pacemaker can have RTMS without any problem.
I see. That's
So,
useful. Yeah.
so it really is important if there's any metal piece within the head and face area, then we do not recommend RTMS treatment for depression or any other mental disorders. But otherwise, it's quite safe.
Thank you. So, do you want to tell us some, like, any side effects of RTMS that people might expect? And what is its different from ECT? Like, there are some misconceptions going around. Is RTMS like ECT? Things like that.
That's right. So again, if you think about it, the commonality is it's a brain stimulation treatment, both ECT and TMS. But the big difference is ECT needs anesthesia, which often then brings anesthetic hazards. Because particularly if you think about the elderly population or underlying medical conditions, some of them are not fit for anesthesia, and therefore it brings an added complication. So that's one. ECT also, as we know, it actually brings artificially the seizure. So we administer electricity on both sides, quite high voltage, and it brings a seizure, and that induces some of the resolution of depressive symptoms. But of course, the major problem is that the short-term memory loss, and of course, headache, very, very common. And of course, it needs lots of arrangements, for example, anesthesia, recovery room, and it's not something that we can just done, we can be done in an outpatient procedure. Whereas in RTMS, as I said before, patients are fully conscious, alert. They're encouraged to talk to their therapist or technician, or if they want, they can read a book or watch a video. And the side effects are really, some patients do have, particularly in the initial stages of treatment. And I always say the good tip is to maintain a good hydration, because brain works very hard. So if you maintain a good hydration, that reduces the risk of headache. People often talk about risk of seizure because we are stimulating. That's actually a myth. Firstly, because to have a seizure, we need to stimulate the area of the brain that needs our motor movements. We do not administer TMS on that area. We stimulate the treatment on the sensory area. So actually the TMS, so far in the clinical practice, there hasn't been any significant, sort of incidents of seizure, but it's a theoretical possibility. In case by mistake it is there on the motor cortex, then yes, it can have seizure, but it happens in the research laboratories, but not in the day-to-day clinical practice, because we make sure that the coil is not placed on the motor cortex, and there are lots of precautions. Those are, technicians and the doctors like us who are repeatedly taught about that during the training sessions. So it's quite safe. The other side effects sometimes patients do experience is a bit of tiredness. And it's interesting because initially they get a bit tired, but as the treatment goes on, slowly they really do not experience tiredness, or it subsides, or they start tolerating it. But again, it's not a serious side effect. But those are the two main side effects people do. And yes, they do experience a bit of dehydration, as I said. So adequate hydration is absolutely vital.
So that was really helpful, Dr. Sarkhel.
Thank you.
So if people want to get in touch with you,
Yes.
if they have any particular queries on RTMS or any
Sure.
other treatment, could you let them know how to get in touch with you?
Yes, so we have got various ways you can get in touch with us. So we have got a website, livingmind.co.uk, and the website itself has lots of information where our clinics are, the telephone numbers, email address. We have got an email address, info@livingmind.co.uk. We've also got a telephone number, 079 444 08234. I think I've said it right, but it's in the website anyway.
Yeah.
We also have got on the website, there's a form.
Yeah.
If you don't want to use any of those avenues, you can just write it, what your concerns are, submit it online, and then we will get to see what it is, and we'll straight be back to you over the phone or email.
Yes, thank you. Any final tips before we finish our interview today, Dr. Sarkhel?
Yes, so
how to manage well-being, how to manage this anxiety.
Absolutely. So I think I'll come back to the mindfulness again, but one word, maybe if I can ask the viewers to remember, and that's called choice. So we have got a choice how we want to feel, and it's incredible. We must empower ourselves that whether we want to feel miserable, or whether we want to feel in a very, in a fearful state all the time, or we actually are able to adapt our life, our mental state. So as soon as we know, we can tell us we have got a choice, immediately the world opens up. And then the idea is how we can have a choice, particularly towards adapting to this new environment around us, adapting to this fearful state, adapting to this uncertain things. That's something that we talked about. But it's important to tell us that we have got a choice. We are powerful ourselves. We can make the difference, of course, with some help needed. Okay.
Thank you, Dr. Sarkhel. Thanks so much for being with us today. I would also like to remind everybody that at Living Life Stress Free, we run regular webinars. At the moment, we are running one every Friday. So the next one is on the 29th of May at 12:30 to 2:30. So we are giving out free tickets on Eventbrite website. So I'll post a link as well. So Dr. Sarkhel, thank you so much for being with us to be our guest today. And I think everybody's going to appreciate whatever you say today. It was so helpful in these times.
Yeah, and thank you, Dr. Sinha, for taking this initiative. And I know that you have got a series of interviews coming up, and you already conducted few. So I'll strongly urge the viewers to have a look at it. I know that it's going to be in the YouTube, and you'll be also having it through the podcasts.
Yeah.
But
Yes.
thank you so much for
Yes.
inviting me.
Thank you. It's my pleasure. So, yeah. And I hope to, and hopefully after this, lockdown and whatever is over, we can catch up in person.
Sure, sure. Look forward to that. Thank you.
Thank you. Bye-bye.